for us to look at something that has found its way into our conversation really almost every day for, the last couple of months. And this now brings us around the areas of emergency medicine. Dr. Sheila Chek is the emergency medicine physician at the Aga Khan University Hospital and is in the hot seat this morning. Good morning, Dr.
Good morning. How are you?
Very well, thank you. Mm-hmm. I feel like sometimes whenever a doctor asks us how we are, we lie.
That's true. The response is always, I'm fine. And then you get into what is bringing you to the hospital.
Can I just say I am?
Yeah, you can.
Because if I were truly fine, if I was sitting in your office, I wouldn't be there.
Yeah, that's true.
Right?
Yeah.
Okay. Mm-hmm. But I'm fine.
You're fine. Okay. Good to know.
Karibu sana. Thank you for being here.
Okay.
We would like to welcome you to the Situation Room with our proverb. We go to the African continent every week. We come back from a different country.
Okay.
And we come back with their proverbs. So now when somebody has traveled and they come back and they said, what did you bring me? Well, we bring you the proverbs, okay? Mm-hmm. Now, we'd love to get your interpretation of this.
Okay.
This week, we're in the kingdom of Eswatini. And this proverb goes like this. A person whose heart is not content is like a snake which tries to swallow an elephant.
Wow. Okay. So a snake cannot be able to swallow an elephant, I mean, logically speaking. So it means no matter what you try and eat, if you don't address the reason for why you're discontent, you'll keep trying to, figure out the next big thing that you feel is going to meet your needs. So I think the root should be to address the source of your discontentment. Yeah.
Figure out what's going on inside first of all, and then we can deal with the rest.
Yeah.
How's that for something to do this weekend, folks? And especially when we're talking about medicine this morning. But thank you for that. That's great. We're looking at emergency medicine this morning. First of all, when we hear emergency and medicine, we're thinking ambulances flying all over the place and that somebody needs to be administered first aid and that we need to rush them to the... what's that place called? A&E?
Yes.
Accident and emergency. What is that, emergency medicine?
So... basically, an emergency, by definition, is an illness or an injury that can threaten your life or your organ function or your limb. So emergency medicine is basically trying to bridge that gap, okay, by intervening and preventing loss of life, loss of limb, or loss of organ function. So that's where emergency medicine comes in.
Okay.
Yeah.
All right. Now, as you say this, I picture the many instances where you're driving down the streets or whatever, and you see that a crowd has formed around an individual, and somebody is saying, "Leta maji, hapana, toa nguo, no, ita daktari." Fan the thing. And we've everybody's crowded around, and somebody say, "No, move." Is that one of the situations that we'll be talking about?
Yes, yes. Usually in these situations, either somebody has collapsed on the road or has been found unresponsive, and people, by default, you rush to the scene. Everybody's trying to help the best way they know how, and sometimes that can do more harm than good. But so in such a scenario, now we need to have a discussion on what is the most appropriate thing to do when something like that happens. Yeah.
Because emergencies do happen, and they will happen. As you say, maybe from an accident or just the body experiencing some shock, and depending on what the cause may be.
Yeah.
But in terms of appropriateness, in terms of response, which could determine now the next step, whether the person survives, or even when the person survives, sometimes the emergency response that was accorded may cause more harm. May leave you with a condition that perhaps if there was better management during the emergency, it would not have occurred. But what, generally speaking, unless somebody finds themselves into a hospital, they are the mercies of just a well-wisher.
Yeah.
Could be a nurse, could be a friend, could be somebody who has no
medical know-how.
But how is that to be managed, generally speaking, before we get to a hospital setup? When an emergency happens, you don't know whether it's an epileptic episode, maybe it's a road accident, it could be anything. But what are some of the key things to at least try and enforce or be mindful of?
So that's a good question, because statistically, majority of whether it's loss of life or grievous injury has already set in before someone gets to the hospital.
Yeah.
So that pre-hospital care, that duration of time before they get to a functioning facility is critical and will determine the course of life. So when such an emergency happens, I think the primary message would be for the well-wishers not to try and cause more harm. So if you don't have the, technical know-how of how to manage an emergency, the best thing to do is to call for help. Okay. I know the emergency response toll-free lines that exist, 999 and 111. So you can dial that, or
anywhere across the country.
Yes.
Okay.
And then there's also an app actually called Casualty app that is in Play Store, Apple Store, where you can download and you classify yourself. You say you're not a healthcare provider, but it has it will be able to triangulate your location and triangulate the nearest hospitals and ambulances that are within your reach. And there are also phone numbers available there. So that is what I would say, call for help. Because even as one person, you cannot, you can't work alone.
Yeah.
Even in a hospital setting, doctors don't work alone. We have a whole team. So that is what I would say.
Yeah.
And I agree with you because sometimes we do more harm trying to help. Now, sometimes you see ambulances running about, and because we have to demystify some of the things we do as Kenyans, so we can be more woke. How important is it to give way to an ambulance?
I think it's one of the road traffic rules, actually.
Yes.
To always give way to an ambulance. Some people assume, this ambulance is trying to beat traffic. That's why, it has the sirens on. But no, as soon as you see an ambulance, whether or not it has sirens on, it is your duty as a Kenyan on the road to automatically give way. Okay. So, yeah.
So it could be saving life.
Yeah.
You be a responsible citizen responding to an emergency situation by allowing those who are on their way to or from an emergency situation get there as fast as they can.
Yes.
All right. Do you have enough comfort, in your opinion? Because these are questions that really come up.
Yeah.
The ambulance came late. They came, they did not have water. But, you hear all sorts of comments. Because, again, the emergency response team, the more they are well equipped, the more they are well organized, the more they are well coordinated, the faster they get to the scene, the higher the chances of them being effective. But how is our emergency level response in terms of quality, both in terms of equipment and time, according to you? Where are we as a country?
We are on the right track. Definitely there is room for improvement. Our pre-hospital care is wanting to some level. Yes, we have ambulances, both public and private, but we know the challenge that comes with some of these public ambulances. Sometimes, there's no fuel, it's this and that. So I think one, also training of the healthcare providers that are emergency trained has been an issue. I think we have about less than 10 emergency medical consultant physicians.
In the country?
In the country.
Less than 10?
Yes, or around 10. Paramedics who are trained in emergency care, about 1,000. There's a program in KMTC. And then we also have nurses who are emergency trained on how to recognize emergencies and sort of push them up the line. So, but I think there's still more that can be done. I know there's legislation, I think it's in the works, trying to sort of standardize the curriculum for the paramedics, so that one approach to their curriculum is going to make sure that when care is being provided by a paramedic, it's the accurate thing that is being done. So I think we are somewhere, but there's still room for improvement.
Okay.
Yeah.
What does the law say about how an emergency ought to be handled? And this is not on the street when we're calling 911 or 111. This is at the facility when an emergency has been brought to the A&E and care has to be administered. In this case, where you talk about the threat of loss of life, loss of limb, or loss of, what's the other one?
Organ function.
Organ function.
Yes.
So there is an emergency. It is quite visible to everybody who is there. But the reality of our times is that usually there is a demand for payment before care is administered. What's the procedure? How should it be?
So the Constitution of Kenya is very, very clear when it comes to emergency care. One, every Kenyan has a right to life, a right to dignity, and for that dignity to be protected. And when you're in an emergency situation, basically you are at risk. So the Constitution, I think it's in Article 43 or something, it says that you should not be denied emergency care. When an emergency happens, it is your right as a Kenyan to access emergency medical services. There should not be any question of pay a deposit upfront. And I think there's even a fine of up to 3 million for facilities that try to ask that, but I don't know if it's being implemented. So
it's not.
It's not.
It's not.
Really,
Long story short, it's not being implemented. So that is, the law is very clear that you should be able to access emergency services, even under SHA, for up to 24 hours from the time of this injury or this threat to life occurs. You can go to any medical hospital in this country, and for up to 24 hours, your emergency care will be catered for under SHA.
Who's the person, or who are the people, who's the body that's supposed to be dealing with this matter? Because, Dr. Chek, there are stories untold in great number. People have been at the brink of death. People have been at death's door. People have died at medical facilities because this emergency care has not been administered because people are waiting for payment. Who like if you go today and you've been referred and somebody says, if you don't get this person to the HDU or the ICU right now, this person will die. Who is the person that if you go to and they say, well, pay the 400,000 shillings deposit before we can attend to you? Who's the person that you go to and say, well, you know what, Dr. Chek, these guys told me to pay 400,000 shillings. I was trying to get it together while we were hoping that they would have attended to this person, and they didn't, and my person died. Who was handling that?
So I think I'll first highlight something. So when it comes to emergency care provision, the key is to stabilize this person so that they're no longer at risk. So that is what is critical in such situations. Of course, healthcare is expensive anywhere in the world, more so in this country. So you should not be denied emergency care enough to stabilize you.
Okay.
Now, after you're stable, then perhaps conversations like that can be had as to, perhaps transfer to either a facility that has more, like can offer a better scope of treatment, or if it's an issue of funds, then to somewhere that is a bit more affordable. So I think the Kenya Medical Board and other stakeholders in the Ministry of Health, they are working together to ensure that such conversations about money are not had within that period of time when someone is at risk. Yeah.
Okay.
It would be interesting to see how that goes, because we've lost quite a number of people.
Yeah.
Either they were outrightly denied and they were told you have to go somewhere else if you cannot afford here, and they needed emergency care.
Yeah.
Or you've had cases, people were just put in some waiting bay, for processing and all that. And yet the primary, as you put it, should be to stabilize the person.
Yeah.
Because you're trying to save a life. So it'll be interesting to see how the conversation goes. And hopefully all the players are involved, because again, you don't want a situation whereby you have a policy and it has gaps.
Yeah.
Those gaps cost lives. That's the unfortunate bit.
Yeah.
But maybe looking from a different angle, what kind of emergencies would you say are more prevalent? The cases you're dealing with mostly. How do they look like? What are the numbers? What are the main causes?
I think the biggest burden of most emergency departments in Africa and even across the world is trauma. Trauma, encompasses road traffic accidents, assault, domestic violence, falls, even industrial accidents that happen in these processing or manufacturing companies. That's the biggest burden that overwhelms the emergency departments. And then also, because of the rise of non-communicable diseases, your hypertension, your diabetes, then also there's a burden for stroke and myocardial infarction or heart attack, as people call it. And then we also see a lot of infectious causes like pneumonia, sepsis, and then also maternity-related complications. And environmental or poisonings also happens, like snake bites, scorpion bites, or even whether accidental or intentional ingestion of unsafe substances.
Now you spoke of snake bites. Just recently we had cases whereby in some areas of the country the antidote, you'd call it, was not available. They go to a facility, and unfortunately there's a case where we lost a young girl, I think, and that's just a reported case. So how would you, the equipment, the medicine, the drugs, and all the other apparatus that are needed in terms of supply and access by the medical response team, because if you're in an urban setting, chances are there could be a private facility near you, and they have it. But now, when you hear that, you as a person who is in that space of emergency response, how do you interpret that?
I think I would say in such scenarios, there's lack of a collaborative effort between counties. Because with devolution, we know that provision of services was moved to county governments, and then national government is more about policy. So, yes, it's true. Sometimes in a particular county, they may not have an antidote, but across, the next county, they do have. So there should be some sort of collaborative effort. There should be in place data where we know, this is in stock, this is not in stock. Also, equipping of our accident and emergency units should be a priority, where, you make sure you have emergency trained personnel, you have protective personal equipment, your masks, your gloves, and other stuff. You also make sure that you have the ability to recognize these emergencies and intervene. Now, in the case of snake bites, I know there have even been cases where, yes, the antidote is there, but it expired 3, 4, 5 years ago. So I think just having that data and getting the counties to collaborate so that they know this is available here, this isn't available here, so that we can all work together to save life.
Is that conversation happening? Because I'm also looking at cases like from the coast. There are those poisonous fish, let me call them up, the divers, the deep sea fishing crew. Sometimes they'll come up and they need emergency care, and the response is not there. If it is non-national, like now, you can cluster. In my opinion, this region is prone to these airborne illnesses. There could be emergencies. These are the ones, snake bites. Is the emergency team, let me call them that nationally, yearning or working towards organizing themselves, as you say, so there is enough collaboration, knowing that in this area we are prone to this such of emergencies, and therefore we need this sort of equipment, we need this policy at the county level, and the government, the national government needs to come in at this level. Are you having that conversation to ensure that now the response is not just timely but also effective?
Yeah, so that conversation has been had and is ongoing. There's actually a policy in place that is being implemented, and in this sort of general conversation, it is aiming at making sure that all counties have a functioning and fully equipped emergency unit. So there is a conversation, there are projects that are ongoing through there's a particular foundation, the Emergency Medicine Care Foundation Kenya, that has done a lot in terms of collaborating with the national government to make sure that all these counties are fully equipped. So they have a Project 47, that is aiming towards making sure, these services are available across the country.
Okay. What about the importance that is or should be placed on individuals getting that, first aid training, so that in the event that something happens around you, then, at the very basic minimum, you're able to administer some kind of care before then it's escalated. Is that a conversation that is being had or should be had?
So that is a conversation that should be had nationally, actually. There are short courses that are available even for non-medics, available for everyone. There's a basic short course called Basic Life Support that anyone can do, and it's just about recognizing sort of common emergencies and knowing when to escalate care. That's one of the courses that are there. We also have other advanced courses that cater to trauma, cater to cardiac events, pediatric cases as well. So those are the short courses that are available. In terms of training for healthcare workers, we have the paramedics who have a program of their own. We also have emergency programs in Kenya. There's an emergency critical care for clinical officers that's being run in Kijabe and Tenwek. We also have a diploma in primary emergency care affiliated to the College of Medicine South Africa, which is being provided in Aga Khan University, and it trains medical officers in providing primary emergency care. So those are some of the things that are available for both non-medical care personnel and healthcare workers.
Do you foresee a situation? Well, I mean, the basics that you need if you're in a home setting, but should everybody have that? You know how at some point they made sure that everybody's vehicle needed to have a first aid kit. Also for vehicles, and then also would you need one in your home as well?
I think it would be, that would be my recommendation actually. If we can get basic life support to be inserted into all curriculum out there, whether someone is in a medical related course or not, such that even when you're in an unfamiliar setting, you know what to do when an emergency arises. So having some of these basic equipment like gloves, so that, because even when providing care, one is asking for help, and another basic thing is to making sure that you yourself are safe. So having, your gloves, so that you don't come in contact with contaminants. Just being around your environment is something that should be policy. I think so,
Okay, so now when we look at what the law says and what the common practice is, oftentimes we are not quite sure how to wade in the middle of those waters. That do people then take decisions whereby it is the looking after human life that takes priority over the rest, or trying to meet the bottom line? And as a medical practitioner, obviously leading thought from an institution, what should it be? Now we're going a little bit subjective. What should it be, regardless of what the bottom line may be or what policy takes place?
So I think the bottom line should be provision of urgent care when needed, to stabilize and save life.
Okay.
That should cut across institutions, whether public or private, whether it's pre-hospital care. Sometimes we've had scenarios where you call an ambulance and then they say, okay, you have to pay first before we get you to the hospital. So it should cut across whether it's in the hospital or out of hospital setting. That should be something that Kenyans should know, that it's within their right to access emergency services without being asked to pay for money upfront. Yeah.
The county system in the country creates a bit of an imbalance in this sense, that not all the facilities that are available in one county would then be available in another. Is there an overall general conversation about creating that balance to ensure that you don't have to have people in an emergency situation moving across counties to then get care? That at the very least there should be, that I could be wherever, but that I can be assured that that first primary state of care is administered and not having to move, exacerbating the situation by having to travel. We told the horror story last year of a woman who was in, I don't know if it's called protracted labor, and went to a hospital which should have offered the care, but she had to travel 2 counties because they said, here, we can't help you. That's an emergency situation, and she had to travel. The general conversation, leading thought around what should be to ensure that at whatever port of call you go to, that you will then receive the emergency care that you need. Is that a conversation that's happening, and what should actually be done to ensure that that is the case?
So I'll talk again about how important collaboration is, because for low to middle income countries, even the basic doctor to patient ratio, when you take into account population of a place, it's not optimum yet. So some of these conversations are much deeper or much larger than just the provision of care. It encompasses staffing, and not just staffing or having this medical personnel, but them having that training to know how to handle an emergency. So I'd say that we are not there yet in terms of having enough personnel, but when it comes to provision of care, it is true that there are some facilities that do not have that capability, and that's why we have levels. We have, your dispensary, your health center, then you have your sub-county hospital, county referral. So it's important that even when Kenyans are going to seek emergency care, they have some sort of knowledge when it comes to what possible services can I get. For example, if I go to a dispensary, perhaps I may only get first aid or be patched up so that I'm okay enough to get to where I need to go. So that's a much deeper and larger conversation that I'm aware is being had by both the national and county governments, and I think we are on the right track. Yeah.
But now looking at the standard of practice, what is the appropriate response time to an emergency situation, and what is our Kenyan response time?
It's funny you ask that question, because I know there are situations where an ambulance has been called and it fails to get there, or citing, send money for fuel fast or whatever. So the recommended response time should be 5 to 10 minutes, depending on where this emergency is located. Of course, there are some areas that are harder or deeper to reach. I only know that in Nairobi County, we are trying, but upwards of 40 minutes to 2 hours. That's,
So you're 4 times late. Wow.
Yeah.
And yet life depends on it. Well, there's another interesting dynamic that sometimes does not play out in the medicine arena about development, how we organize our roads, accessibility, because maybe the 40 minutes some minutes can be attributed. It's not an excuse for you to come 40 minutes later, but I think you can see how it can play out. Are you even at an advisory point, you know, do you have those platforms that as this conversation happen about equipping, you know, the personnel, equipping maybe the ambulances and the facilities, that also we, as we organize our country, we need to have controlled development that also allows response, timely response, and improves on the quality of accessibility. Or again, perhaps the question would be, do you feel comfortable in our setup of our country in terms of order, organization, vis-a-vis accessibility?
I think when you talk about the development and roads, that might be a bit out of my scope. But what I can say is you find in some of these countries, they have dedicated lanes for ambulances or emergency services, which again helps to shorten the time between when an emergency happens and when someone gets to hospital. But I know that these policies exist, and the challenge is with implementation, because like I said, the national government is responsible for creating this framework and policies, and the county governments should implement. So there's an issue on funding, because again, not all counties get the same distribution of funds to be able to provide such services. So I think at this particular point, perhaps what can help to mitigate is just collaboration and implementation, because these policies are already in existence. Yeah.
Okay. A lot of times we sit with issues, medical issues, that we may not realize are emergencies. And so we say, well, okay, it might get better. What would you classify an emergency to be? Because we think, okay, if there's no blood spewing all over the place or something, then maybe we can wait a little bit. How would you classify an emergency if we had come into contact with it?
So just think about our definition of what an emergency is, right? So if your organ function is being affected, then that counts as an emergency. So if you're having shortness of breath, that is, not going away, that is continuous, or if you're having chest pain that is, out of the ordinary, then that should prompt you to go to an emergency facility. If you are choking, for example, that is also an emergency. If being unresponsive or not being able to be to perform your regular function as usual, that counts as an emergency. And what you say is true, that most of the times people wait for one reason or the other before going to the facility, and therefore by the time they come in, to some degree there's some harm that has been caused. So I think I would advise people not to wait too long. If you're feeling unwell, if you're not feeling like your usual self, then it's best to go to a health facility and be assessed, such that if there's an urgent intervention that needs to be made, it can be made in good time.
Okay.
Yeah.
Now let's demystify some things. Some homemade emergency response innovations. When someone suffers a burn, I don't know what Ndu does or would do, but I've seen people have sprinkled wheat flour. Is that okay? I don't know whether that okay is the right question. Also, when someone ingests something poisonous, maybe they've drank a poison, is it in order, like people try to induce puking, maybe giving them lots of water. But there are instances you hear when you reverse, the reaction is worse. So help us demystify some of these homemade
remedies.
Yes.
Okay. So I've seen and encountered scenarios where patients come with flour on the buns. So it doesn't work.
Okay.
Yes. Because it increases the risk of complications or infections, because this flour has been processed in a non-sterile fashion. So when you put it on the skin that is already compromised or hurt, you are potentially making things worse. And then when it comes to ingestion of poisons, yes, inducing vomiting is not helpful because you find some of these substances are very corrosive. So it like corroded your esophagus when it was going down, and then now when you try to induce vomiting, it's again getting an opportunity to do the same. And sometimes that can cause small tears that will cause these substances to spill where they shouldn't spill. Again, you can find bleeding happening because of people shoving things in the mouth. Also, I think something I've encountered is the patients who have a seizure or a convulsion, and then you try to, shove things in the mouth. So, yes, that's not advisable. You're likely to not only hurt the person, but also hurt yourself because in that scenario, they can, really bite off your finger. Yeah, so such remedies have, they are being passed on from one person to another, but they can be harmful.
But in defense of shoving things in someone's mouth when they're having a convulsion, you're trying to protect them from biting their tongue off. That's the panic reaction. So what are some of the especially in those three cases that we are trying to demystify in terms of burns? Is there anything one can do at home before the pre-hospital in terms of having ingested poison and the convulsion? Is there sometimes sitting and watching is really not an option.
So with burns, definitely depends on how bad the burn is. Majority of the burns are caused by something hot liquid or hot water spilling. So you can run it in cold water and then go to a facility. That's Don't try to pop any blisters that form. No. Just run it in cold water. It might help with pain, and then go to a health facility. When it comes to ingestion of substances, again, do not induce vomiting. Do not give milk. I know people give milk to try and neutralize, but it doesn't work. So don't give milk. Rather note what the poisonous substances is. Make a note of it because it might be helpful to the healthcare provider to know what to give and what not to give depending on what has been ingested. Get them to a health facility. For in the case of a seizure, again, calling for help and then just making sure that they are safe, you are safe, and they are safe. So, for example, if someone is in a chair and they start having this convulsion, the best thing you can do is to make sure they don't fall down and hurt themselves, and then you can place them on their left side. Majority of the time, within a few minutes, it should abate. Yes, they're going to be snoring. It's very, can be quite shocking. All right, but just lay them on their left side and make sure that they're not in an environment that is going to hurt them more. Say someone was cooking and they're next to a stove and they start having a convulsion, just move them away from the fire, lay them on the floor, and don't try to hold them. Because that might cause more damage.
So we're talking about emergency medicine, and there are a number of questions that are coming through because now we have an emergency specialists in the house. So when we're talking about the policy and things like that, there are also certain situations which are common that people just don't know what to do. The burns and such have been one of them. Another big one that is coming up is when somebody may have been electrocuted. What is the first port of call to do there before you bring them to a medical facility if necessary?
Do you hit them?
Shock them back into reality?
Oh, no. So again, I will emphasize on safety for yourself. If you're witnessing such an event happening, sometimes the response is you want to help, you want to go and
grab them,
grab the person and move them to safety, but you might also conduct the same electricity and in turn get electrocuted. So if you are not, or if it is not safe to approach, do not approach. Your safety comes first. That's a priority. Call for help. And then if most of the time after the shock is delivered, someone falls to the ground perhaps and is rendered unconscious. Again, make sure it is safe. You can just lay them on their left side, call for help, and wait for the emergency personnel to go and bring them to a health facility. I'm trying to avoid instances where I'm telling people, do this, and they're not safe. So your safety is a priority.
Okay.
Yeah.
What about when somebody is bitten by a dog?
You bite it back, right?
That's what would make the news.
No, don't bite the dog back.
Okay.
If you're bitten by a dog, majority of the times there might be a stray dog. So cases of potentially the dog having rabies is high. So if you're bitten by a dog, don't bring the dog to hospital. Don't bite the dog back.
Okay.
Yes, go to a healthcare facility. And of course, there are some questions that we ask. For example, if it's a domesticated dog, those ones are most likely vaccinated. So depending on where the injury is located, when the dog was vaccinated, or if it's not vaccinated, then there's a rabies vaccine.
Yeah.
That is available in hospitals.
Okay. There's a couple more of these.
Okay.
And if you were to have stepped on a rusty nail or been scratched by a piece of metal, what should you do?
I don't want to say, but
What did you do?
What did you do?
you pee on it.
You pee on the rusty nail?
Ask boys. I'm speaking for boys.
Okay.
Well, there's an emergency specialist in the house. Perhaps she can tell us
we are
if you've been doing the wrong thing.
Yes,
multiple times.
It's sanitized, but please.
Okay.
Okay. So if you step on a rusty nail, you go to a health facility. Again, questions will be asked. If you have received a tetanus shot within 10 years,
Yeah.
most likely you don't need to get another shot.
Okay.
But if not, or you can't remember, then it's, you're better safe than sorry. So again, there's a tetanus IM injection that we give, and that is preventive. Yeah.
Like for real, medically speaking. Why are you laughing? Peeing on a fresh wound is not medically recommended.
No, it is not.
Okay.
Yes.
We need to have a conversation with a lot of boys.
A lot of
boys.
demystify a lot of
Yes,
this.
yes. No.
And comments will tell you. I wonder how many people will confirm they've done that. But it's good to know.
Yeah.
Thank
Do
you.
not pee on fresh
So,
wounds.
okay.
Yeah.
All right. So another one that comes up we've done the burns. Another one that comes up for a lot of folks is then if a tooth, and this one happens to me actually, if a tooth has been knocked out, we've been told that the first thing that you do before you go to the emergency is that you either wash it in milk and put it back, and then find your way to the especially for a child. What do you do in that situation?
So yes, putting it in milk is actually one of the things that people do at home. That
It's correct, not
Yes.
those other things.
Okay.
Yes, it's correct.
Okay.
So you can also put it in a container that has milk, and it's not a must that you attach it. And then again, go to a facility that has dental facilities. Yeah, depending on the extent, whether it's the whole tooth or half of the tooth, there are certain remedies that can be offered. But yeah, putting it in milk for the meantime works. And then also, there are also cases of maybe you were working and, you chopped a finger.
Piece, yes.
Yeah. You can put it in ice and then bring the finger in, with you when you go to the hospital.
Because
There's potential depending on how severe the injury is and other things. Yeah, but putting it in ice and bringing it along,
Okay.
that's a good thing to do.
And the eye, putting it in water.
Yes.
Yes.
So with the spillage, let's say you were washing laundry and jig accidentally spilled in your eye. Yes.
You can
Washing
run.
it, run. Lots of water, tap water is just fine. Run.
Fresh.
Yes.
Okay.
Run water through it and then go to a medical facility. Yeah.
Okay. So one other that comes in is that when you get sand or dust in the eye looking at cornea scratches and things like that, if you get sand in your eye, the initial thing is to want to rub it. What should you do in that situation? And is this classified as an emergency issue, or any particle in your eye for that matter?
Yeah. So if you get sand in your eyes, wash it out with lots of water. And because of scratches to the cornea that would happen with rough substances such as sand can potentially lead to complications down the line that would affect vision and quality of life. So yes, that counts as an emergency because it might potentially affect the functioning of your eyes. So just wash it in water and go to a health facility. There are some certain tests and remedies that we offer depending on the extent of the injury.
Okay.
Yeah.
Okay.
Is there, but I think this is obvious, if a child ingests something, some of the things, they are not harmful because maybe they are not pricky and sharp. And sometimes there's a temptation of just wait it out. They will excrete it.
Yeah.
But who should make that determination?
That should be the doctor. So yes, ingestion of coins. Children also put beads and other things up their nose and ears. So it is important for the child to be evaluated by an emergency trained healthcare worker. Because trying to remove it or manually by yourself at home can cause more harm. So just bring them to a health facility. Now, when it comes to ingestion, the coin or this foreign object might go either to the windpipe or the trachea or the food pipe, the esophagus. So, of course, if it was swallowed and it went through the food pipe, chances are it's going to be passed out. But that's a decision that should be made upon evaluation. If it goes into the trachea, then it might cause shortness of breath, difficulty in breathing. You might hear a strange sound coming from the throat, and that is a proper emergency. Yes.
One more demystifying.
There's another one after the one more. Okay.
A fishbone gets stuck somewhere along the esophagus, along the way. Some people advise just eat ugali,
and turn the other,
and cough it off. It's not as serious, but I'm using a fishbone as one of the many things that could. But what should be the appropriate, or you just go to a medical care? Or is there anything you can do at home, especially for the adults?
Yeah. So. Swallowing, trying to swallow whatever semi-solid food might help, because this round, let's say it's ugali, it's round. You've tried to chew it or swallow it as big as possible, and then it will stimulate movement or peristalsis. So that might help to move the fishbone down. But other times that might not work. So if you're still someone still feels like there's something stuck on their throat, you're frequently clearing your throat, then it's important for you to come to a health facility where it can be assessed. Again, it depends on how big the bone is and how it's lodged. Definitely when you try to swallow a piece of ugali, it might dislodge and it will go down smoothly. Other times, if it's a long fishbone and it the way it's angled is a bit off, then it might not be possible to dislodge at home by yourself by trying to eat a solid object. So then sometimes there have been cases where people come and they have to get a procedure called an endoscopy, which involves them, making sure they're not feeling any pain, and then manually going in and taking out the fishbone.
Okay.
Yeah.
So the presence of blood is usually a no-brainer. For anybody, is like, okay, this is crazy, we've got to go somewhere. And also realizing that blood from certain parts will be more than others, and so might cause concern. And one of those is nosebleeds. With nosebleeds, when is it an issue, or when is it just pinch the bridge of your nose and you're fine? When is that a situation whereby you must go to emergency? So
nosebleeds are quite common. It can happen especially if your nose is dry, maybe during the hot and windy season. So it's common. So when it happens, then perhaps it has not responded to the remedies, which I'm going to talk about in a few. Let's say within 15-30 minutes, then that's a cause for concern. Perhaps you should come to a facility to be evaluated. Now, I know the what we were all told is if your nose bleeding, pinch your nose, throw your head back, and wait.
Yeah.
So the appropriate thing to do is actually, yes, you can try to pinch the bridge of your nose, but don't throw your head back.
Okay.
Sit up straight. Sometimes because the nosebleed might be dramatic or it might be large in amount, sometimes the blood tends to get into the throat.
Yeah.
So people, try to spit it out or swallow. It's okay, you can do that, but the leaning back doesn't help.
Okay.
Yeah. So just try to be calm, definitely.
So
But
if this persists after 30 minutes, then you want to go to the hospital.
Yeah.
Okay.
Yeah.
Earlier on, you mentioned, as our time winds down, you mentioned this, and I think it's great because we're in a time where the digital space consumes a lot of. You mentioned the app that you can actually download in case you need to call someone apart from the 999-111. Is it Casualty? Is that what it's called?
Yes, it's called Casualty app.
And anybody, how does it? Anybody can download it and use it, and then be able to call emergency services.
Yes, so it's a multi-purpose app. It has. As I said, when you download it and you sign up, it asks you, are you a healthcare worker or are you not? So if you're not, then there are some things that will not be available for you. Okay. So if you're just a regular non-healthcare provider, you'll have access to emergency ambulance services. And when you're on the app, it will, let's say you've had a road traffic accident and you have the app with you, you get on to the app, you'll find a phone number for ambulance services. Okay. You call, the dispatcher is able to triangulate your position and find the nearest ambulance that's closest to you, and therefore they will dispatch it to you. So yes, it has provisions for that. For the healthcare workers out there, it has algorithms that have been developed that even in a rural facility or an urban facility, there are things that can help you in terms of managing such patients.
It's interesting because Kenya has 100,000 plus community health promoters.
Yes.
Who then, in a lot of cases, especially in what we would not at peri-urban or rural areas, would be the first port of call for something that was an emergency. Would it make sense for them also to have access to this, or would it be something that should be promoted at that level?
I think it should be promoted for clinicians working in the facilities.
Okay.
Commonly, the community health promoters or workers, they're more within the community.
Yes.
They are the link. So it might not be as helpful to them, but I think just maybe increasing awareness that such an app exists for ambulance services and things like that. That's something that they can take up. But when it comes to actual practice, it's more beneficial for those who are working in healthcare facilities.
What would be your call to action as we wind this conversation down about what folks need to do when it comes to emergency care?
When you meet an emergency, make sure you are safe, call for help, and be aware of your rights, that you are entitled to emergency care services in any hospital in the country.
That does it for the Situation Room this week. Our Healthy Friday conversation with Dr. Sheila Chek has been around emergency medicine and the Aga Khan University Hospital, leading that conversation about what you need to do and what you remember. Thank you for doing this with us this morning.
Thank you.
Good morning, everybody. Thanks for winding down the week with us. These conversations have been important for us to have. We do it again Monday, God willing. Have a great weekend.
This is the Situation Room, the only way to start your day.